She started making friends on the internet, falling in love, and she convinced some dude to come and murder her mom. And he did.
He did. This is where I get frustrated.
Don't even open that can of worms.
Like horrifying.
Horrifying. Not allowed to cry or have emotions in your house?
Like, do you really need to know what Zymoglophicol 8 is? Or
oh, Jessica.
Everyone has a favorite. Everyone does. All right, today we're talking about one of my favorite, like, diagnoses. Is that the right? Diagnoses?
Mm-hmm,
Diagnoses?
mm-hmm.
Yeah. Because, I don't know, I'm just, like, fascinated by, like, a handful of them in the DSM because they're, like, not understood well.
Yeah.
Okay, so today we're talking about Munchausen's by Proxy. So, trend stats, facts, what's, like, the DSM definition?
Okay. So first of all, I'll say that, like, we no longer call it Munchausen's.
Oh, we don't?
No.
Oh, whoops.
No. I mean, but that's like that's the word that people know, out in the community. That's what we used to call it.
Yeah.
It's now called factitious disorder.
Oh,
so you can
that's
have
what
Munchausen's disorder or Munchausen's by proxy, which is now called factitious disorder or factitious disorder imposed on another.
Jesus. That's like
It's a mouthful.
You're right.
It's a mouthful.
What does factitious mean? I guess lying?
Yeah. Faking. Yeah. Faking. Factitious.
Can't say faking.
Yes. It'd be fake. So just like a little boring history for you.
Yeah.
Because I was like, what is Munchausen?
Yeah.
So it was like this German officer in the 18th century who was like well known for exaggerating stories about, like, I guess, battles he was in and stuff and his life. Okay. So he just was an embellisher. So we did use that term for a while. We've changed it now, but so the DSM-5, which is our diagnostic statistical manual in mental health, it's like our book of diagnoses. Here's the definition. So for factitious disorder imposed on self, so if, like, you have it, okay, and I'm going to read that because you have to understand that to know what by proxy means. All right. So it's the falsification of physical or psychological symptoms or induction of injury or disease. So causing yourself to have some kind of injury or disease associated with deception. The individual presents himself or herself to others as ill, impaired, or injured. The deceptive behavior is evident even in the absence of obvious external rewards. So there's a big difference between this and what we call malingering, okay? You know malingering, Jessica? So
sure, but tell the people.
Malingering is faking illness, injury, disease, whatever, to get something like disability checks.
Oh, SSI. Yeah. Okay.
So get some kind of, like, external reward. All right. Whereas Munchausen's or factitious disorder, there is no external reward. Okay. So there's not necessarily. There can be, but that's not the ultimate goal, is to get that.
What is the ultimate goal?
Well, we'll get into that. Okay. And then the behavior is not better explained by some other psychiatric problem. Okay. Like psychosis. Okay. So Munchausen's by proxy, or now known as factitious disorder imposed on another, is all of those symptoms, but a person is doing it to someone else who's technically their victim. So a lot of times it's a parent to a child. Okay. Or
like spouse.
I think it can be that, or like if someone's taking care of
a
elderly person.
Yeah.
Right. But I think the most common is parent to a child. God, that's the most common out there. Okay.
Crazy.
So ways that people fake illness, injury, it can be just like exaggerating symptoms. It can be creating symptoms that do not really exist. It can be actually causing some kind of illness or injury to yourself. It leads to a bunch of unnecessary medical interventions. Okay. So some examples. A person can report having had a seizure. Okay. And if it was unwitnessed, there's no way to really tell if the person had a seizure. Right.
Okay. Yeah.
Or what we call a syncopal episode. So like fainting, blacking out. Right. So like you can just report that happened at your house, and who's to say that it didn't.
Yeah.
Right. Manipulating laboratory tests. Okay. This is something we actually saw in residency. Like we had this person who was chronically in the hospital, and it was crazy what he would do. So things like adding blood to urine sample,
Ew.
falsifying medical records, ingesting some kind of substance
Yeah.
to make you sick, like insulin or warfarin, which is a blood thinner, to induce like an abnormal lab value, and then actually injuring yourself to get sick. Like our patient would, this is the example, and I was like, oh, our patient did that, injecting fecal material, which is poo-poo, to produce an abscess or induce sepsis, which is like a infection throughout your bloodstream.
Wait, inject it, meaning like with
a
shots?
needle.
Ugh.
Yeah.
How do you get it?
He did that.
Dilute it?
I don't even remember. And then when he was in the what's so crazy is like he would do that at home. Okay.
Yeah.
So he would like inject himself with all kinds of shit, poop, whatever he could find. And then when he was in the hospital and had an IV, when the nurses would leave,
He would take the IV out.
he would actually get poop into the IV.
Cool. How? He would like take it
he would
out?
undo like
Yeah.
where
the
connects
port
to the
or whatever?
tube. Yeah.
Yeah.
And like get like try and like stick poop down in there.
Ew.
I mean, it was so gross.
So gross. Did he get septic?
Yeah. Yeah. Oh yeah.
Shit.
I think he ended up with like limbs amputated, like all kinds of shit.
My
yeah.
God.
Oh yeah, crazy stuff.
Okay.
Okay, so like how common is this? The problem is that it can be really hard to diagnose this, right? So we were
Okay.
talking about this earlier.
Yeah.
Okay. Medical professionals, like physicians, we assume people are telling us the truth.
Yeah.
That's our assumption,
Yeah.
right? Is that you're being honest and telling us the truth.
Yeah.
We don't go into this assuming you're lying.
Right.
Right? So, and like we take these oaths where we're like supposed to help people.
Yeah,
right?
do good
and not
or whatever.
cause harm.
Yeah.
Okay. And so if someone comes to us with some reported ailment, disease, or whatever,
Mhm.
our reaction is to, okay,
Fix.
let's do some tests. Let's figure out a medication, a treatment plan, or whatever. Our impulse is not to say, let me investigate this further and make sure you're not lying to me.
Which is
right?
my job. I mean, like, it's
Yeah.
like, it's interesting because I was thinking about this the other day. Like, medical professionals, like medicine is very different than like a mental health provider.
Yes.
Like, I don't come in. If a client comes in, like a parent or whatever, like saying they're like the kid's the problem, like here's all the shit. Like I don't think they're lying, but I think they're lying to themselves about the why.
Right.
You know?
Right. So
Like,
your training gives you a different perspective on it. You know, whereas like our training is like someone's in need, I need to help them.
Yeah,
you know?
correct.
And so it can be really hard to diagnose these patients, especially because they tend to jump from doctor to doctor, hospital to hospital.
They doctor shop.
Yeah. So they very rarely stay with the same provider long enough for that person to figure out that something fishy's going on, right?
Mm-hmm.
So the estimate is that it's about 1%, but most
Probably
likely it's higher.
Yeah.
And then just like, what does this look like over time for someone? Okay, so onset is usually in young adulthood.
So like
20s, early 20s.
Okay.
Often after a hospitalization for a legitimate medical condition.
Oh, what do you mean?
Or mental disorder. Okay, so a lot of times what happens is a person gets hospitalized for like a real, true medical problem. Okay,
like
let's say
you gotta get your appendix taken out.
Yeah, whatever, or gallbladder, whatever.
Mhm.
Okay, and then my assumption is that during that experience, they're getting a lot of attention.
Yep.
Right, and like they're being helped. People are taking care of them.
Mhm.
Okay, and so then it sets off this disorder where they're constantly trying to seek that out. Right.
Yeah.
This isn't like outlined in the DSM, but that's my thought process of why that happens.
What do you like? Okay, so that's the start of the course. What, like, are there any like trends or themes or whatever as it relates to like is anybody like predisposed, or like is like abuse something that like happened in childhood? You know what I mean? Like,
from what I remember, sometimes it's that people like had a lot of illnesses as a kid, or they had a parent that was very sick.
Mm-hmm.
I wouldn't doubt that like there's probably a fairly high
like
prevalence
ACEs
of
or
abuse in these people, you know, history of abuse. Because I think we see that with like every mental health disorder, right?
Yeah.
Like if you were abused as a kid, you're more likely to have X, Y, and Z every mental health disorder, right?
Yeah.
So I wouldn't doubt that, but I do think that something that can predispose people is like if they had illnesses like in themselves or in the family when they were growing up, but that doesn't happen for every patient.
Yeah.
So, you know, I was telling you about that podcast I listened to, Nobody Should Believe Me, which is about, they follow like one particular person for most of the podcast, but then she kind of breaks off and talks about like, other people who have been officially diagnosed with this, and actually gotten treatment. And then she interviews like this organization that's, I can't remember, I think it's in the Midwest somewhere, that they actually track Munchausen's.
Cool.
And so the main character that they follow, like I'm pretty sure from what I remember, it was like a pretty average, normal childhood. Like there wasn't anything, because they talked to her sister. Her sister is like one of the main interviewees.
Okay.
And like there wasn't any kind of like major red flags until she was a young adult and like shit started happening.
But like, okay, because this makes me think of like schizophrenia, because it's also, isn't like that the time of diagnosis or whatever?
It can be. Usually
like
it's a little bit earlier.
Oh, okay.
For women, yes, you're right. For women, it usually is early 20s. Boys, it's usually earlier.
And like, so Munchausen, I mean, whatever, factitious disorder imposed on another or on yourself, like the function of it is attention.
Correct.
So like that makes me think that like why does that person need that attention?
Right. I kind of think like, okay, if someone has Munchausen's themselves, okay, so like factitious disorder imposed on self, which is like the official term. If that is starting in young adulthood, what makes me think is like, okay, this is the first time the person's out on their own and not being cared for by a parent.
Okay,
right?
Yep, that makes sense.
And so they're like seeking other ways to feel cared for.
Yeah.
Right.
Okay. Yep, that makes sense. Okay, keep going. Okay. Course.
Okay, so yeah, course of
20.
disease over time. So usually it starts in young adulthood after some kind of hospitalization. And then it usually like kind of comes and goes over time. So what they say like intermittent episodes. So people will have like waves of time where they're engaging in this activity and then waves of time when they're not.
Sorry.
And so it's more rare for someone to just be doing this all the time throughout their life or to only have like one episode and be done with it.
Are there like triggering events?
I would guess so. Yeah. I mean, I would guess like some kind of life event probably sets them off and makes them feel this like unconscious need to have attention and, you know, feeling cared for, whatever.
Okay. Okay. So like Munchausen's, so, I mean, what's a factitious disorder imposed on yourself? I mean, they doctor shop.
They hospital shop.
They hospital shop. Is it usually like one disease that comes back? No, it's 1,000. It's
like ton, and that's part of it. That's what I think. That's part of it that makes it hard, right? Is it's usually not just like, oh, I have seizures, and that's like their primary complaint for 20 years, right? Because people would figure that out eventually. No, it's like I have seizures, and then I also have these recurrent infections, and then I also have, you know, whatever the FL. So they change it over time.
Yeah.
So that like takes advantage of the medical system, because then you're seeing this neurologist over here and that cardiologist there and that gastrointestinal doctor there and then that rheumatologist there, who none of them are probably talking to each other.
That's right. Yeah.
Right?
Yeah.
And so they're all like kind of with their blinders on, treating that like one little problem and not seeing that like, oh, there's this whole other issue going on, and this person has 400 medical complaints and they're seeing 50 doctors. Yeah. Right? Yeah. So I think these people, and I'm not saying they necessarily are doing this consciously in the way that I'm saying, but they're able to kind of like split doctors in that way. Right?
Yeah. I mean, I think it's
I mean, it is, but it's I don't know. It's strange. Like, I think if you talk to those people, like they know they're doing it.
Yeah.
Right. But I think that need for attention and need to be cared for, like that part's unconscious, I think.
Oh.
I think that they know they're faking shit.
Yeah.
Do you know what I'm saying?
Yeah.
Does that make sense?
Yeah.
But I don't think that they're fully aware of like why they're doing it. Yeah.
Interesting. That's
Unless
weird.
they like get into therapy and figure it out, you know?
Yeah. Okay. Are these like people diagnosed with one of these two?
Right.
Are they usually like single? Like, is there anything like
I don't know. I don't
like
know if there's like a whole
family?
lot of statistics on that.
Yeah.
I'm sure that it's probably harder to get away with if you're married.
Yeah.
Right?
Yeah.
Because then there's like a person very close to you to call you on your bullshit.
Yeah.
It's probably harder to get away with, but
like also,
or you can have someone who's super enabling.
Yeah, correct. That's what I was going to say.
It enables that to continue
like,
and feeds it.
Yeah. I mean, what am I, like, there's so many people married to addicts.
Yeah.
And it's like not the same thing, but like.
Kind of.
Yeah,
Kind
right?
of.
Okay. So by proxy.
Yeah.
I mean, whatever, impose on another.
Yes.
Okay. Usually parent to kid.
Right.
Everybody knows Gypsy Rose.
Yeah.
Like yeah. So everyone knows that. We're not going to like get super into that. I want to hear about your examples, like case examples.
And just like in case you don't, because I like kind of forgot about Gypsy Rose and like what was the story, but just in case you don't know it, I'm just going to give the elevator pitch.
Yeah.
Did you know she was originally from Louisiana?
By
She
the
a
way
Louisiana
she
girl.
I mean,
but she ended up in a
Rose.
different state. So anyway, her mom, since she was like an infant, claimed that she had all kinds of disorders, that she had muscular dystrophy. She had to be in a wheelchair. She needed a feeding tube. She needed an oxygen tank. The mom ended up through all of this, like they had a house built for them by Habitat for Humanity. They had like, she got awards from some organization, whatever. And then as this girl got into adulthood, which she didn't even know she was an adult. You know, the mom like faked her birth certificates. And so she thought she was like 14 forever.
Yeah.
So as she became
acted
an adult,
like it too.
Yeah. So as she became an adult, she started making friends on the internet, falling in love, and she convinced some dude to come and murder her mom. And he did.
He did.
And they both went to jail for that. So
wait, but okay. And also, I'm going to throw this out. 6th Sense. Remember Misha Barton?
Yes, which I like. I need to go back and watch that because I kind of
her mom. That was by proxy too. Why? Like, what makes someone by proxy or impose on themselves?
Like what sends them down the path of doing it to themselves or someone else? Yeah. Okay. Ooh, that's a really good question.
Or is it like, did they try to do it on themselves? It didn't work, so now they're
maybe
because like it's still attention.
Yeah.
But like if you're doing it on someone else, then you're also like reinforcing. It's like you need to be needed.
Yeah.
So it's like extra layer.
The by proxy creeps me out.
It's fucked.
It is so creepy to think that like someone can do that to their kid. It creeps me out.
Because and like they got to be fucking smart. You know what I mean? Their IQ has to be
deceiving
high.
Physicians.
But, yeah, you're doing that, but you also have to like, you're teetering. You know how to teeter. You know how to do it just enough to get just sick enough and not die.
Yes.
And like that takes, I mean, I would assume a pretty high IQ. Okay, that was Gypsy Rose. Case example. Give me some stuff.
Yeah, so and I'm going to try to not like reveal too much, HIPAA. But I have a patient that, well, she's no longer my patient, but
she went to another doctor.
May have had it. Like looking back, but I saw this person for years. Like, I don't know.
Like start age. Ballpark.
Young adult. College.
Yeah.
Started with college age.
Okay.
And then I followed, I'm going to say them now. I followed them for probably about 6 years. And there were a lot of like pretty serious medical. Yeah.
What was like reason, why'd she come
initially?
in? Yeah.
I want to say it was like depression, anxiety.
Oh, okay.
Kind of like my bread and butter.
Yeah.
You know?
Okay.
And when we established, there were no major medical issues.
Okay.
It was just like depression, anxiety, college is stressful, whatever.
Yeah.
Okay. And then I followed them over the course of whatever, 5-6 years, something like that. And like it took a few, like this didn't happen in the first like 2 years of our treatment relationship. Like it happened after that, where it was like, you know, I think it started with like fertility issues. Okay.
Wait.
Uh-huh.
What do you mean?
Like
She's
trouble
20.
having yeah, but got married really early.
Oh.
Yeah.
Okay.
Got married very early.
Wait.
So there was...
Hold on a minute. It's like,
Okay.
no, no. Okay. She came in, whatever. We all have anxiety, depression. College is hard. So now I am investigating. Was there a lot of like med management issues, meaning like, oh, it's not working, or I need a different dose, or I need to try a new med, or da-da-da-da-da?
Yes, but I would say it was not my worst. It didn't like stand out in the beginning as like, this is my problem child.
Yeah.
Right?
Yeah.
Okay, it was kind of just like normal, like, oh, I'm having finals, my anxiety is ramping up. We gotta make some changes.
Yeah,
okay?
yeah.
There was no major red flags out the gate. None.
Okay.
Zero.
Did she did she get therapy outside, like actual counseling?
Yes.
She did. Did you consult with that counselor?
Mm-hmm.
What'd she say at the beginning?
It took us both a minute to... Oh, in the beginning? Well, okay, so here's part of the problem is that there was like one therapist that was seen in college because it was like, I think someone on campus.
Yeah.
And then there was like a separate therapist once
she
they
left.
graduated from college and like had a job and like was able to actually pay for a therapist. So I was the only one that was seeing that person for the whole time.
Okay.
Right? Okay. And so it started with like fertility issues.
Okay.
Couldn't have a baby, whatever. And so there was like a lot of interventions happening to help with that process.
Yeah.
Or at least reported to me.
Like IVF, IUI?
Yeah.
Yeah, okay.
And then there was like, all of a sudden we have cancer.
Sorry.
But like looking back, I can say now, but in the moment, I'm not going to like, if someone tells me they have cancer, I'm never going to be like, oh, shut the fuck up. No, you don't.
Correct. And like I'm assuming she was like, oh, this is the reason I'm infertile.
Yes.
Yeah.
Yes.
Okay. So she's smart.
And that makes sense, right? Because like,
I don't know.
I've had other patients who who were trying to get pregnant and ended up having cancer. That's not the first time I've heard that, you know? And so, so this person had moved out of state. Okay. And I usually will cover someone for like a few months until they find a psychiatrist wherever they move, because it is hard to find psychiatrists, right? Yeah. But of course, these things would happen. So now looking back, I can put two and two together. Yeah. But in the moment, I wasn't.
She's always in crisis.
She's always in crisis when we're trying to move her on to somebody else, right? And so there was like this massive GI thing that needed surgery. There was like cancer. There was, the cancer came back. And so it took me like probably maybe, I would say 2 years to kind of sit back and be like, wait a second, what is going on here? Like something is fishy here.
Yeah, sounds like it. Yeah.
And so looking back, I can say that, but in the moment I wasn't thinking like that.
Well, but you also have like you don't, I feel like this is all, and this is doctors, like all of y'all see so many people that like, I mean, it's like turning over. You know what I mean? Right. Like you don't have time to sit and reflect. Yeah, correct. Right. Then you could like sit and reflect and look at notes and like look at timeline. Who's she seeing? Let me talk to. But like that's just not your reality. And so I
have like 400 patients. So it's like,
correct.
I mean,
yeah.
So anyway, finally at the end, I was able to be like, this is no longer going to work. You just cold turkey like called her out? I just no, I didn't. I didn't. But I was just like,
did you like challenge her at any point to be like,
no, because the problem is like the mental health situation was so fragile that
I mean, was it?
Yeah, well, but how do you know?
Yeah.
If you push someone to a point and you're like, you know, I think they're bullshitting, they're not going to kill themselves, and then they kill themselves.
She was suicidal?
Yeah. I mean, it was more like they were continuing with the therapist that they were with at that time. And so I told the therapist, I was like, this is what I think is going on.
What was the therapist saying?
The therapist was like kind of having at like the same realizations, like in the same time frame that I was.
Okay.
Like we were both like starting to be suspicious at the same time.
Yeah.
So I was like, look, since you are continuing this person, I am imparting this knowledge onto you, and like do what you will with it, you know?
Yeah.
But it's hard because it's like, you know, I've had patients like this patient where like I try to call their neurosurgeon or their oncologist or whatever, and like that person doesn't have time to get back to me. Yeah. And then it's just lost.
Yeah.
And this is how these people just
Yeah.
continue on with life.
Cheating the system.
Yeah.
Yeah. What, like, can you, like, is there a way to, like, I don't know, like, what intervention, like, what do you do?
So, what I liked about that podcast, that Nobody Should Believe Me, which y'all should listen to, it's really good. They actually, they interview this organization that, like I said, I think they're in the Midwest somewhere.
Yeah.
That is actually starting to try to track these patients. Like they're trying to get like
a database?
Yeah, like a database, basically. Yeah. Okay, so that they can, and then if these patients move out of state, they can like notify whatever doctors are saying, whatever. And so they said that there are some organizations similar to them that are like popping up around the country. So I think that as like technology advances and like we're all able to communicate more easily, like I think that it's probably going to be caught more. But you think about it, for how many decades were people able to do this? And like, if they moved out of state, nobody would know.
Yeah.
Nobody would know. They can just continue on abusing the medical system themselves, their child, whatever.
I mean, what, like how, like by proxy or imposed on another?
I would say that that's probably a little bit easier to find, right? The one when people are doing it to themselves, that's a little bit tricky.
Yeah.
When it's to a child, I think that, you know, like just like anyone who works with kids, we always have to have in the back of our minds, like, is there any risk of abuse, right? Is there any risk of neglect? Yeah. I think this is in the same vein, right? Because this is a form of abuse.
Yeah, medical abuse.
So it's just like if a kid has these, you know, multiple confusing, sometimes unexplainable symptoms, then you do start to have to wonder, you know, is there something suspicious going on here? I think that's when, like, you know, doctors need to communicate with each other. Yeah. Right? So that we're not all like on our own plane and like existing separately, right? You have to communicate with each other. I actually, now that I'm thinking about it, I have another one right now where like I am suspicious of it and I've had to talk to the therapist, you know? I'm not giving anything away.
I know. I just want to talk offline.
Oh, no, we'll talk offline about it. Yeah. I thought you were looking at me like I'm giving away like really personal information.
No.
But yeah.
No.
And it's a hard conversation to have as a provider because you're basically saying you don't believe people. You know? And that's hard. And it's like I had to kind of like tiptoe into that conversation, and thank God the other provider was like, yeah, I see what you're saying. Like I'm worried about that too, you know? Yeah. So providers have to talk to each other. That's really the best way, is like for all the providers to get on the same page.
An intervention.
Yeah.
And like if it's on a kid. Like what do? You report it.
Oh, you gotta report that to DCFS or whatever your organization is called in your state. You gotta report it because it's abuse.
No, it is. It's just like DCFS. I mean, no,
they don't. Well, in Louisiana.
Well, right, but they don't. They're not medical professionals, so they're not gonna like be knowledgeable about like all the shit that's in the house.
Right.
So like, could a provider like call the police or like something like how do you know what I mean?
I know, but I think like I think it always ends up so with any type of abuse, right? You report to DCFS or like Child and Family Services, whatever it's called in your state. But if there is concern that the child is like in danger at this moment, then yes, you do call the police.
Yeah. But what if you don't have any, like there's no evidence?
I know, that's the hard part.
But like you don't, and we're going to talk about this soon, like in Ruby Frankie or just like anybody abusing their kid. It's like, how would a parent get charged with medical abuse? You know what I mean? Like, is there a way to charge them with that? Medical?
Yes.
Like if like they, and that would be like a doctor, or is it, that's, they have that. Like, don't they have like medical professionals who like do forensics?
Yes. Yep.
To do like, you have like X medication, this causation, and this is why it's all fucked.
Yeah. So like here, which I think this is the same in every state, I'm assuming, but like here, if you report child abuse and DCFS investigates, we have a place called the Care Center. Where like kids go to be forensically interviewed by a usually it's like a it's usually pediatricians who have like specialized forensic training.
Yeah. I thought
and
that
then
was
there's like
just
social
for
workers
abuse.
there.
Like physical or sexual. It's not?
I think that this would fall under their domain.
Okay.
Because it is considered, I mean, that is a form of physical abuse.
Yeah, but they need like all the shit. Like, don't they need to see all the stuff, all the meds?
Yeah, but I think that's where they would be like the investigating group, I guess.
Yeah. Okay.
And then they'd probably be getting information from whatever doctors that child has seen.
Yeah.
Right?
Okay.
So I'm assuming it's the same in other states, or like a similar process to that. But yeah, I mean, it's abuse. So it's like if it's ongoing, but you don't think the child is in imminent danger, it goes to DCFS. If the child's in imminent danger, it goes to the police.
Yeah. And like, how do you know if it's imminent or not?
Yeah. I mean, I don't know. I don't know. I guess maybe if they were doing like really scary things like making the kid septic, because that can kill you very quickly.
Very quickly. Or like if they're, like, I guess you don't know, but like if they're ingesting like poison, fertilizer.
Then it is imminent danger. But
Has
I think
anyone
a lot
died?
of times it's more subtle. You know? That's a really good question. That's a really good question that I don't know the answer to.
I'm going to look it up.
I'm sure.
Yeah. Like, whoops, too much fertilizer.
But then part of the problem there is that...
Cause of death, you don't know because there's so much shit in there.
Correct.
Yeah. Fuck.
Or like, how do you know, like by the time someone has died, how do you know? I mean, I guess you could look back and be like, oh, they had all these weird illnesses. Like, I wonder if they had factitious disorder imposed on another. But yeah, I'm sure there's been instances where they've died.
Oh, is there like a, this is my last question. Like, are there any like specific, like socioeconomic populations that it like fault like this happens more with? No,
I think it's definitely the majority are women.
Yeah.
Although my one in residency that I talked about was
a
man.
boy. Yeah. Man somewhere.
But the majority are women.
Okay.
Yeah. But I don't think there's any division as far as like socioeconomic status goes. I don't think.
Wonder because like if you're trying to get a check from the government, like it has to be like in a certain bracket.
Yeah, but that's more malingering, right?
Oh fuck! Like yeah, you're right. No, you're right. You're right.
So this is more purely for attention, and like being coddled and taken care of, right?
But what if you get a check too?
Well, I guess that's just a bonus.
That's your tip. Okay. Wrap up. I mean, I don't know. Like, if you see anybody with Munchausen's,
please,
like,
please call us. Let us know.
Like, I mean, but like, honestly, I did have, like I told you, I had a friend like text me because she was suspicious that a friend of hers was displaying symptoms of this, and like, I don't know, like.
Okay, so one thing I will say is if there is someone in your life that you suspect is doing this to themselves or to their child, okay, you can call that person's provider and tell them your concerns.
Oh, okay.
They just can't say anything to you.
Yes.
Right? So
got
like
it.
I have people call me and they're like, hey, I'm concerned about my husband, son, cousin, friend, whatever. And I just like can't confirm or deny that that's my patient, but I can take the information. Right?
Okay.
So you can do that. You can call their provider and say like, this is what I'm worried about. Yeah. You can whatever. Email, call.
Good. I didn't know that. Okay. So
if
you suspect, you could also call DCFS.
Yeah, if it's
like
absolutely.
I mean, if it's
Any
a kid or whatever,
DCFS, right?
It's anonymous. So if you suspect factitious disorder imposed on yourself and or others, you can call call, email, pediatrician, therapist, whatever. I mean, they're not going to confirm or deny anything.
But you can still call them.
But like they'll get the information.
Or if it's a kid, call the school.
Yeah,
you can call the school. They're mandated reporters.
That's exactly right. Yep. Coaches. Yeah. Like anybody who's in the kid's life. Yes. Really.
Yep.
Gosh, it's so fascinating.
I know.
It's fucking crazy. It's crazy.
It's wild.
But can you treat it? No.
I mean, so, you know, on the podcast, when they talk to that organization, like they do connect these people
with therapists.
Yeah, but it's, you know, you got to voluntarily go to a therapist, right?
Right.
You don't have to see a therapist. So unless
can you be found, what's it, jail?
Yes.
But can you, what is it called when involuntary
commitment?
Yeah.
So that differs state to state. What are the criteria for that? And it's usually pretty strict criteria.
So like, no.
Right. Because like, you know, like in Louisiana, a person has to be suicidal. Okay. So giving yourself illnesses is not suicidal, right?
Yeah.
They have to be homicidal.
Yeah.
Or what we call gravely disabled, which is mean like they can't access like food, water,
basic needs,
shelter, whatever. Okay. Yeah. So if a person doesn't meet those criteria, you can't involuntarily commit them to an acute psychiatric hospital.
Yeah. Like long term.
Long term is tough because it has to be voluntary for the most part, you know? Like the person has to be willing to go. Or if like sometimes you have someone in an acute unit and they're like so psychiatrically disabled that you can transfer them to a long-term unit, but they have to do the acute part first.
Yeah.
You can't just get them into the long-term. Yeah. And that's our state.
Yeah.
But I think it's, you know, I think it's pretty strict everywhere. Yeah.
Yeah. Okay. Yeah. Oh, interesting.
I know.
I want like another, like a film or another movie to come out like with like a by proxy.
Yeah.
Just like it's fucking crazy. Anyways, okay, guys, if there are any, just like scroll through the DSM, and if any diagnoses like tickle your pickle, we'll totally deep dive into them. I'm sure they fascinate me as well.
Fun.
It's so fun. It really is. Okay, so rate, subscribe, review, leave a comment, tell your friends, tell your mama, all the
tell
people,
your work people,
tell your work people, yeah,
everyone, please,
yeah,
so we can do this full time.
Yeah,
right?
Please.
We're begging you. Please.
Please. Okay. Thanks for listening.
Bye.
Bye. Thank you for tuning in to this episode of the Little Brain Campaign podcast.
If you enjoyed our conversation, give us a follow on your favorite podcast platform so you never miss an episode.
Do you know someone who would be interested in this topic? Take a minute to share this episode with them.
Until next time, remember, we're all just trying our best.
See you next week.